Good evening, Facebook. Dr. Andrew Merrill here, and I think I have fixed it. I'm not sure how I fixed it, but I just tried again, and I think that you can hear me now. So I'm going to keep talking. Even if you can't hear me right now, you can turn me off, tune me out, and hopefully that there is some sound to this later on when we on the rewatch and or on YouTube when I post it later. But I was talking again about how you could crack your own back and maybe you can get some great results 2 weeks ago. And if you didn't get a chance to see that video, I recommend that you go see that video to figure out how to adjust yourself the right way. So anyways, tonight we're talking about kind of in defense of chiropractic and why you should go to the chiropractor, right? Why would you go see a professional to do something that you could do yourself just as well? Well, the answer obviously is that you cannot do it as well as we could do it, much the same way as I cannot adjust myself as well as somebody else can adjust me. Miss Emily, I don't believe that we're going to play a game tonight. This is going to be pretty quick, but it's going to be pretty succinct about what's going on. And after I talk about neck pain here just a little bit, I want to quickly talk to you guys about this coronavirus pandemic and kind of my 2 cents on the world as it stands. So pretty quick today. No game tonight, but maybe next week we'll play a new quiz show game because I have another one all put together, but not yet. There's always next week, exactly. Anyways, real quick on neck pain, right? So 70% of people have this at some point in their life. Obviously, there's a need to treat this. We see it very commonly here in the office because it is so common, and that is kind of one of our specialties. People often want to answer to where it came from, but in most cases, we can't give them that answer because we don't know, right? So it's classified as non-specific neck pain across the literature because sometimes people can guess where it came from. You can ask them some questions that it actually came from somewhere else. It's not really a one-size-fits-all, so we just lump it all into non-specific neck pain, and that's the research that we're going to talk about here real quick tonight. We get a lot of skeptical folks in here too, right? So this is why, again, I wanted to talk about in defense of chiropractic. So we get people who say, I've never been to a chiropractor, I never wanted to go to a chiropractor, I didn't think I needed to go to a chiropractor, and I don't think that you can help me. That's literally how they come in. And so it's like, I got a pretty uphill battle, but I'll give it a whirl as long as you're willing to work with me a little bit. But it stems from some real life scenarios, some real things. Joe Rogan was in the news here today. He just signed a big deal with Spotify on his podcast. And, he's a staunch anti-chiropractic person. And it has to do with his experience with the chiropractor who overcharged, overtreated, and didn't give him the results he was looking for. And furthermore, didn't make an appropriate referral to somebody when he was not getting good results with Joe Rogan and his spine. And that's why Joe Rogan is like, well, all chiropractors are bad because they all do this, but that's not true. Everyone's different, so it's kind of throwing the baby out with the bathwater, I would argue. But, everyone has that friend or that person who maybe had a bad experience with a certain profession, and then they lump them all in there. So we get really good results with neck pain, and I'm going to real quick talk to you about this study that came out. So they took 20,000 individuals who were receiving chiropractic care, and they looked at some of the similarities that those people had when they came in and what the chiropractors did and the similarities to that, and then figured out what kind of results they would get with carefully selected patients, right? And so we termed that all clinical prediction rules, right? So when you're trying to get the best outcome for a certain condition, you want to make sure that you have the right condition, you have the right diagnosis, and you have the right treatment going towards that diagnosis so that you get a good outcome. And if you had 4 of these 7 symptoms or 7 things going on, you were somewhere in the tune of 70 to 95% likely to have immediate relief at the chiropractor from the symptoms that you're feeling. So those 7 presenting symptoms were neck pain, shoulder and arm pain, reduced motion of the neck or shoulder, stiffness, headaches, upper and mid back pain, or none of the presenting symptoms, right, which is one of those 7. If you had 4 of those, you were more likely to have immediate results at the chiropractor because he was fixing neck pain that was a result of something that was going on in the joints, which chiropractors are great at treating, right? So that is the prediction rules, and we get great results as long as you fit into those group of people. If you have some of those symptoms that I just mentioned, you would probably get good results at the chiropractor, at least according to the research, according to the statistics. Now, what would not get a favorable response, right? What would not get well under these same rules? And that was numbness of the upper limbs, meaning you can't feel your fingers, and that was fainting and dizziness. So fainting and dizziness do not respond well immediately to chiropractic care and are probably not the kind of conditions that we are looking to see in the office. Typically, I'll refer those out to get care somewhere else. So how do we get these clinical predictor outcomes? Well, we ask a lot of questions in the office. And real quick, I wanted to talk to you about some of those questions that I ask routinely a lot. I've got patients who say, not again, don't ask me if, my pain level on a scale of 1 to 10, except that it's part and parcel of what we do. And it doesn't matter what that number is. It matters that that number is getting better, right? So if I'm doing a good job and you are getting better and feeling better, then you're getting that good outcome, and the number doesn't matter. If you say, I feel great when the pain level gets down to a 4 or a 5, then I've done my job and we're good. So some of those other questions that we ask is we ask a lot of what makes the pain better and worse. We ask a lot of the timing component to the pain. We ask, what have you tried to get rid of the pain so far? We use a bunch of different questionnaires here in the office because we are looking to track your progress and make sure that we can also live up to those expectations that when you have a good candidate for the treatment that you're providing, that your treatment is working and the patient is actually getting better. So we use a lot of clinical outcome tools to make sure that we're tracking you getting better. So let's see. I want to talk real quick about the things that we do. So we talk about adjustments. We talked about cracking your own neck or cracking your own back the other day. We do a lot of adjustments here. Obviously, when people think of the chiropractor, they think of the spinal adjustment, and we do that quite a bit. We also do a lot of soft tissue therapy, muscle therapy that the massage therapists here at the office provide. A little bit of physical therapy modalities, a little bit of posture exercises, a lot of education, modification of certain activities throughout the day. And then, like I mentioned earlier, we do some co-management with some other specialties. So that's how we go about treating that stuff, and that's why we get such great outcomes with neck pain in particular. So in defense of chiropractic, if you don't get good results when you are cracking your own neck, I would recommend that you come in and let a professional take a look at it, because we can very quickly identify if you are going to be somebody who needs something besides what you're doing, or if we can give you some pretty instant relief, right? Let's see. So I got a question here. How do you factor in degenerative arthritis for us old guys? So that's a good question. And we talked about that actually when we talked about the predictors for how quickly you'll get well after a car accident. So that is something that plays in directly to how quickly we expect a patient to heal, is that degenerative arthritis. Because when you have arthritis in those facet joints, the joints in the back of your spine, not the disc, in the back, it actually predisposes you to have more chronic pain, longer pain, and higher levels of pain. So we look at it more in the prognosis of what we expect for you, but not necessarily in will you get immediate relief, right? So that's an important distinction to make. So even if we get you immediate relief, it might not be permanent relief. So we expect for you to get well on maybe a different timeline, but definitely still to get well. I hope that answers the question there. I'm not sure if it does exactly. Anyways, so kind of straightforward tonight. As usual, if you ever want to talk to me about anything, you can email me, drmerrill@nightlightchiropractic.com. You can find all of our old videos either here on Facebook, on YouTube, or on our blog, which is nightlightchiropracticonline.com. Now, real quickly, I wanted to talk to you about being kind. And this is kind of weird, right? Because in this coronavirus coming out of quarantine pandemic, it's a weird new world. And I think everyone's on edge a little bit. And I think it's been too long since everyone had some hugs to kind of relax a little bit and take a step back. And right now, the old adage of being kind because you don't know what somebody else is going through has never meant more, I think, than right this minute. So right now what I'm seeing a lot of is when people are talking about somebody else, they think that somebody else is taking unnecessary risks. They're taking unnecessary risks. They're doing unnecessary things. They're going out too much. They're seeing too many people. They're not following the letters of the law when it comes to social distancing or wearing a mask or any of these other things. And then when it comes time to talk about what they're doing, it's a whole different set of scenarios. And so I would argue that everyone gets to do a little bit of this their own way. The research that we have is on the best science that we have, and we have some things that I would argue that you conform to, although I'm not going to be the one who's yelling at you in the grocery store if you're not wearing a mask. It's going to be somebody in the grocery store. It's going to be somebody else, not me. but it's going to happen. And even if they're not kind, I would argue that you can be extra kind to still diffuse some of these situations as they happen. I would argue that even if it's just for appearances and you don't believe it's doing you any good, I would still follow what the CDC is saying. I would still stay 6 feet away from people. I would still follow best practices to wash your hands. I would still wear the mask out no matter where you're going if you're going to be around people, because it's going to help save lives, I think, here if we see a second spike in these coronavirus cases. So I've got a couple quick questions here. When you wake up and slept wrong and your neck hurts, how long should you wait to see a chiropractor? Fantastic question. I would wait at least 2 or 3 days, using a water bottle to do some traction, using some ice, doing some light stretching, and avoiding things that are going to have you in a flex posture or a place where you are in a bad position with your neck. 2 or 3 days at the least before you come rushing in. We're going to be here. Don't get me wrong. You're more than welcome. It's just that if I had all of my patients come in tomorrow with that, I think that we would be overrun very quickly. And I'm not sure that I can give you better result in those first 2 or 3 days than just waiting those first 2 or 3 days. So 2 or 3 days. And I got one more thing here. I have arthritis and it really hurts. So real quick about spinal arthritis. Spinal arthritis responds really well to 3 different generic compounds that I recommend that you get. One is fish oil, not omega-3, 6, 9, not cod liver oil, not anything else. It should say fish oil on the label. With your medical doctor's approval, I would recommend that you take about 4,000 or 5,000 milligrams per day. It has been shown that it works better than ibuprofen for spinal arthritis, so that's a great place to start. The other 2 substances I would recommend immediately, turmeric and ginger, and I would go after those. Got another question here, and this might be the last question that I field. Do I have an opinion about pillows, type, etc.? I do. And here's the problem with it, is that a lot of the research, much like mattresses, comes out of the industry. And I don't really have much faith when an industry does its own research, because there's something invested for that industry to make certain findings. So we do recommend something called a D-Core or Tri-Core D pillow that we pick up, that we cannot sell as cheaply as Amazon. So if you're going to get one, I would recommend that you go straight to Amazon. But be careful, because you start tinkering with your pillow and you might end up with a bad time. You might end up in worse shape than you are now. Pillows and sleeping positions and what feels comfortable to your neck and what your ligaments and muscles can sustain are very subjective things. And I try not to get involved too much, because there's not good research. So I might be steering you in the wrong direction as much as the right direction. Just be careful if you're going to go tinkering with your pillow. I'd recommend not throwing away your old pillow until you're sure that your new pillow is exactly what you're looking for. So I know that that's not a great answer on that, but it's the best one that I got, unfortunately. Anyways, folks, that's all I have for this evening. Again, if you're in the comments and you want to chat with me, I'm always floating around the comments. Have a wonderful week. As usual, I will see you next week for Wednesday Night Wellness Live. Be well and good night.